Hey, I'm Scott, the kinesiotherapist. Hi, I'm Scott, your kinesiotherapist, and today we're going to talk about ITB syndrome. Now, ITB syndrome starts with the hip and goes all the way down to your knee. It actually is mostly this overworking tensor fasciae latae muscle, the TFL, that's usually contributing to and causing this ITB syndrome. So what we're going to do today is go over that muscle and all the other supportive muscles that should be helping and preventing this muscular imbalance from forming. Then we're going to go over an exercise plan and how you should approach it to eliminate and get relief from this ITB syndrome. So without further ado, let's get to the body. Okay, so here we are looking at the lower extremity body for the ITB, the IT band. That's what this big white tissue here is. Okay, that's the IT band, the iliotibial tract. All right. But what we're going to look at are exactly what muscles influence this. Okay, so this is just ligament tendon tissue. Okay, it's just tissue. It doesn't have the ability to contract or anything like that. Up here are the muscles that have the ability to interact with this IT band and cause it to move your leg and everything. All right. Now, the number one muscle that's attributed to that is this one right here, the tensor fasciae latae, okay, TFL. The big joke is go order this at Starbucks, see what happens. But the tensor fasciae latae, it can do a couple of things, but none of it is like really great at it. It is best as a hip flexor. So what it does is it attaches to the pelvis here, this iliac spine on the bottom part of it, and then attaches to what's called the greater trochanter. Okay, let's look at this. So take away all these muscles. Okay, this is your femur right here. That whole upper leg is your femur, all right? This knob here, okay, this whole knob is called the greater trochanter, okay? And there's a lot of muscles that attach to it, but the TFL attaches onto that right there, and when the muscles shorten, okay, when these muscles shorten, it causes the leg to flex or to lift up this direction in front of your body. All right, that is called hip flexion. But if you look at it, it also has the ability, if it shortens and you want to direct it a certain way, it has the ability to what we call abduction, to bring your leg out away from the midline of the body. It can do that. And then if you look down here, it crosses the knee joint. Okay, so you see that, how the band crosses the knee joint? So it has the ability that it can actually flex and pull on that knee joint or extend the knee joint. I mean, it does it really poorly, but because it crosses the joint, it does have the ability to do that, even though it's really bad at doing that. But its number one cause is hip flexion. It's not the best at it, but that's what it's best known for. So all the muscles that we're going to be talking about when it comes to trying to improve the ITB function and get things stronger is everything that supports this muscle, which include the trunk and spine, as well as the glutes and the legs, just everything that's around that area to try to strengthen and to actually get this to not be overreacting, because that's what's causing it. It's this muscle normally is overworking and doing too much of the work because nothing else is doing what it's supposed to, causing imbalance and an extra stretching, extra pulling on this area, causing a lot of tension and everything, okay? All right, so, but that's not 100% of the reason why IT band kind of like goes into dysfunction. Sometimes it can be as simple as the hip flexors, okay? These hip flexors that are the primary movers for hip flexion aren't doing their job well enough, and so this is just overworking. And then sometimes it's the foot, sometimes it's just the trunk and spine, and sometimes it's actually more about this glute, the medius and maximus, okay? To find out exactly what's going on with your body, the best thing you should do is get assessed. And if you click on the link below in the description, you can come to my website, and for $50, I will myself, not an AI, not a robot, not someone working for me, but myself will assess the body, your body, with pictures, videos, and I will then be able to prescribe exactly what stretches and exercises need to be accomplished in order to help relieve what's going on with your body. Okay? But now let's just get to the exercises for your general cause that will help with the IT syndrome that people are very experience a lot with. Okay? So you can see here we have 8 different exercises. Okay? Or movements, I should say. Some of them are stretches, some of them are strength exercises. Some of them are done daily, some are done weekly. Okay? So these first 3 are daily. These are things that need to be done every single day. Okay? Can you do it more than once a day? Sure, you can do it more than once a day, but you gotta listen to your body. If you feel like you're not feeling what you're supposed to be feeling that we're going to discuss, then you're doing it too much. Okay? As long as you're feeling what you're supposed to be feeling, then everything's okay. All right? So let's look at the very first exercise, sideline quad stretch. So this is a gentle position to be able to get into. Don't worry about if this isn't comfortable, you can do this standing, you can do this kneeling. There's a lot of different variations. This is just what I've chosen to have you guys do because it's the least stressful. You don't have to rely on just your own body and your hand and everything to grab a hold of the foot and stretch it. You can wrap like a rope or a towel or something like that around your foot if you don't have the ability to bend your knee as much and grab a hold of your foot like we're just showing right here. Okay. Now the big thing you don't want to make sure happens is you don't want to see your knee skyrocket up really high. You want to make sure that that knee is aligned with your hip. And you see, women, they have wider hips than genetic women have wider hips than genetic males because of childbearing hips. Okay, that's just evolution. All right, can't get around that. So make sure that if you're a female, a genetic female, that your knee is aligned with your hip and then it's not caved in or it's caved out. And males, if your body is dysfunctional, you'll have the same kind of issue. So make sure you're keeping that in line as well. From there, you want to try to relax your body that's laying on the ground. Okay, as best you can. You want to get it really as comfortable as you possibly can. And then it's very simple. Just bend the knee. Use either a towel, rope, or your foot and grab a hold of it to bend the knee. Now, the thing that you want to think about doing is really easy to hyperextend your back here, your low back. So you don't want to do that. And how you can help yourself from doing that is by engaging your core muscles slightly. Okay, you're not like trying to crush your abs with like exercise or anything like that, but you're just engaging it so you don't feel your low back flexing and pinching. Okay, because that's what can happen. All right, now it does cause new problems. All right. Then the other thing you want to think about doing is squeezing that glute. Okay, that'll help you keep your hip forward so it doesn't kick back, causing you to arch your back, all right? So squeezing that glute and keeping that hip pushed forward, okay, into the front of your body, all right? And then you want to think about squeezing that hamstring, gentle. Everything is gentle. You don't want to do extreme stuff because then you can cramp the muscle and that's not going to feel good, okay? And then when you bring the leg up, you should feel a natural lengthening sensation throughout this entire front half of your entire upper leg. Okay, the whole front half, all right? Not just the outside, not just the inside, not just the middle, the whole thing. That's what you're trying to feel from where we showed with the bony attachments of the femur to the pelvis all the way down to the top of that knee area. Let's look at that again, okay? See this? This is all quad right here. All of this is your quad muscle, okay? And you want to feel all of it, all right? All of it is lengthening, and you should be using these glute muscles and these hamstring muscles back here, okay, to help bend that knee to cause it to lengthen. Remember, I've talked about it in previous videos, in order for this to lengthen properly, this has to shorten properly. If you don't think about shortening this side, then this side won't maintain its lengthened position, this lengthened state, and that's the key. You want to make it so that this maintains its lengthened state that you're trying to put it in. And so the only way that's going to happen is if you focus on shortening this backside, okay, with these muscle and this muscle and a little bit of that muscle. And that will help lengthen this one and this one and this one and all of these, okay? And keep it lengthened. That's the key, keeping it lengthened, All right, so, and then just holding it for the amount of time that's prescribed. Let's watch the video, see how she does it. Comes in, see how she wants to bring the leg up, if she watched it. You know, she's just making sure it's staying in the right position. No arching of the back. Knees not going up into the air. That's exactly how you want it to be done. Okay, next mobility stretch. This was directly into that IT band, okay? So the leg that's being worked is her left, okay, right here, closest to the chair, all right? So it's just step behind, good posture. Big thing here is that it's really easy to compress your spine. Can you see how she's rotating over here? So you just want to be cautious on that. Keep the core engaged, making sure that you're not doing anything stressing your back or anything like that. Use the chair as support, or you can use a wall. It doesn't really matter. Anyway, you kick the leg behind you, comfortable. You want to make sure that it stays straight. Okay, that's key. That needs to stay straight. If it bends, then you're going to add slack, and so you're not going to get as good of the movement. Then you want to think about squeezing the groin muscle, okay, on this, for her left leg, okay, this leg right here. That groin muscle is squeezing gently. The core muscle is squeezing gently. Maybe a little bit of glute engagement as well. And then just dipping the hip, feeling it all lengthen. So look at that bone piece again. You're thinking about, get that out of there. Think about this bone piece being pushed out, okay? That's what you're looking at, okay? Specifically trying to target this area, okay? See how it's in the front part of that side hip there? That front area, and then running all the way down the length of the leg, all right? Okay, let's go back to the video and see it in action. Good comfortable posture position, dipping, using the chair to stabilize. You can use a wall, a couch, anything. Just make sure it's in a comfortable spot where you're not straining anything above the body. All right? Perfect. All right, this is an actual really good, important core exercise, actually. This is for the obliques here on the body, okay? Now, she's doing it by herself, balancing. I'm not a huge fan of that. I prefer people to use something to help balance. If you notice, remember I talked about the hips and everything? The hips are wider among women, and so the knees go in. Now, when you go on one leg like this and you balance, what naturally happens is your hip kicks out so that your foot is in the midline of your body so you can maintain good balance, okay? Problem is that puts things in poor alignment. That's not ideal, all right? So ideally, what you'd want is your foot to be in line with your hip, just like you would be for that quad stretch, okay? So the foot is in line with the hip. The only way that can happen is if you're using something that helps support yourself. So I recommend people being like on a staircase or on the step right here, using like a wall or something to keep your joints in alignment. That way you have less stress going into your knee, less stress going into your hip, all right? And you'll actually be able to strengthen the core even better, okay? So all it is you want to think about the muscles in between your ribs and on top of that hip there, pulling your hip up to your ribs and then controlling the hip dropping below. Okay, so here's the down phase with the foot being lower. Okay, so the hip is down, the muscles are lengthened, and then right here is the up phase where it is shortening these muscles and getting them to contract. Okay, so this is the area that you're trying to strengthen, those oblique-like muscles. You'll feel some of the back muscles, the low back muscles as well. Try to do your best to just in between the rib cage and the pelvis. Okay, let's see the video so we can see it in action. Squeeze up and down. And down. See, there you go. Just ideally using a wall or some type of assistance so you can keep your foot in aligned with your hip. Okay. Sideline leg lift. All right, this is going to be for, let's check it out. More about this muscle right here, the glute medius, okay? It's going to be really easy to use this muscle because, again, this is really strong. It's going to be really dominant. So it might be beneficial to kind of like rotate that foot out
a little bit, like away from the other foot, that can make it a little bit easier to engage this muscle until you get strong enough where you're not feeling this one working. Okay, if you feel the front part of that hip, that side hip working, then that's not right. You want to feel kind of like that mid to back, or even that glute. Okay, so think about trying to squeeze that butt actually, and that'll cause this to work a little bit more. Okay, to try to balance out that imbalance that we're trying to correct. There's the workout right here. Okay, so being comfortable laying, stabilizing, and then as you can see, just lifting straight up, body weight only. As you improve and get stronger, you can throw a band or a weight on there as well. Let's watch the video, see how it goes. That's it. Nice and easy. Good control. That's great, excellent control there. Okay. Don't use momentum. If you're using momentum, then you're not using muscles. So similar kind of motion, but a little bit less stressful, putting a little more emphasis into the glute max with the flexion and everything. Glute mean too. But just a good follow-up, okay? Everything's exactly the same. The only difference is your knees are going to be bent a little bit more and hip flexed a little bit more, okay? So very gentle, nice and slow and controlled. Again, this is really easy to use this front part of the hip, which is that TFL that we want to avoid, all right? So really focus on that backside as much as you possibly can, okay? But essentially, it's this very similar movement, but because the knee's bent, it's a little bit shorter. Now notice the range of motion isn't great and dramatic, okay? Can you go further? Possibly, maybe. If you can, go for it. But notice no rotation in the torso, okay? That's a big key indicator. You want to make sure that there's no rotation going on in your trunk and spine. Otherwise, your trunk and spine is doing the work. We just want this muscle doing the work, okay? All right, now that we're done isolating certain muscles, let's focus on really hitting all the backside everything. Okay, so it's really easy to use your calf muscles on this one. And that's going to be pretty easy for you to do if you're having this ITB issue. What'll be harder for you to use is these glute muscles. That's how come you do the glute isolations first with those abduction type of exercises. You might feel a lot of your hamstrings as well. The goal is to really try to focus in on these glutes, okay, these butt muscles back here. So brace your core. Meaning, like in a plank, you kind of like pull those ribs in towards your spine and have them engaging and just maintaining good posture, okay? You don't want to feel your lower back arching. If you feel your low back doing a lot of work, you're doing it wrong. So it's all in the glutes, okay? Glutes and maybe a little bit of abdominal engagement, all right? You might feel your quad stretching. That's not bad. That's a good thing. You might feel your hip flexor stretching. That's not bad, okay? It's a good thing. And just squeezing those glutes. Let's check out the video and see how it's done. Really focusing on those glutes, okay? If you're feeling a lot of flexion going on the sides, or a lot of like, feels like you're scraping your foot away, like, because you can cheat by doing like a knee extension type of force, pushing your feet out and away, and that'll cause you to lift your hips up also, okay? So that's a cheat, so really make sure you're not doing that. A way that you can try to trick yourself into doing that is if like you're on a flat surface, hard surface like this, having socks on with like hardwood flooring or linoleum or tile or something like that. And if you're pushing your feet away, well, then they're going to slide. So you'll notice that, okay? So that's a little hack that you can try to do to make sure you're not cheating. Okay. Side plank. So this is following up that core exercises in the very, very beginning that you're doing every single day, those oblique lift-ups, okay? Exact same kind of thing, but as an isometric instead, okay? So you're in this position. It's really easy, again, to feel this that TFL engaging, try to hold things up. So you might want to try thinking about squeezing your butt muscle. Squeeze that glute, okay, to help support that leg and pelvis. And then feel those obliques doing all the work, maybe even your low back a little bit. Though they should be engaged, but really focusing on those obliques, those muscles in between the ribs and the top of your pelvis there. Let's check out this video, see how it's done. Oops, didn't start automatically. Make sure that the elbow is right underneath the shoulder. If you feel your shoulder working a lot, well, then that means you're using your shoulder a lot and you're not using your core, okay? So adjust the position of your elbow, it might be that. but then also just really try to focus on not using your shoulder to lift up. You want to think about using these core muscles to lift you up. Okay? Awesome. And then normal plank. Okay, so normal forward front plank, focusing on squeezing these core muscles. It's going to be really easy for you to use this TFL again in this type of position because it's involved in keeping the pelvis straight and everything. Try to engage those glutes. That's going to help create some more balance. Okay, the key thing is if the main cause is an overworking TFL for your typical reasons, then the glutes are going to be pretty weak. Okay, so really focus on squeezing those glutes along with these core muscles, keeping your body perfectly stable. All right. And you don't want to feel like your whole low back at all. You want to feel like an even amount of force is around your entire torso, okay? The core muscles that we're really trying to work on here, they actually attach into the back of your spine here, and they wrap all the way around your entire torso, okay? Your transverse abdominis is that main muscle, and it's like your body's natural girdle, okay? We'll check out the video and see how it's done. Hips are in a good postured position. Again, if you feel your shoulders a lot, it's because you're using your shoulders a lot. You're not using the core as much as you should be using. So try to relax those shoulders. Find a comfortable spot so it doesn't feel like you're having to use those shoulders to stay up as much. And then really just feel those core muscles engaging and hold. Okay? And then if you're feeling your hips at all right here on the side, then try to engage those glutes and try to relax those hips as much as you can. It can be a big body mental tug of war when trying to do any of these exercises. And there you have it. So again, these first three you're going to be doing daily. Okay, a few sets at a time on this hip raise ones on a step or some kind of lift and everything. Otherwise, these other exercises, right, these 5 exercises should only be performed at most 3 times a week. All right, you can see benefit just doing 1 day a week. Probably 2 is going to be a little bit better. But if you feel like 3, you want to pay attention to how your body feels, okay? If you feel like you're getting stronger and better after each time you're doing it, then great, keep doing it, okay? But if you notice like after 2 times, you feel like that was a lot, and then on the 3rd time you start trying to do it, and it's like, it's not feeling as good, well then maybe that's too many times, okay? This is just a general prescription, a general recommendation. If you want something more specific for you, then just click the link in the description and I will prescribe you exactly what you need.
There you go. That's it. That's the best way to relieve that ITB syndrome without doing any kind of personalized assessment. But if this doesn't bring any kind of relief to you, then I highly recommend clicking the link below in the description and letting me assess you to figure out what's actually causing your specific problem. Until next time, I really appreciate you making it to the very end. I'll talk to you soon.